Welcome to Daily Series, COVID-19 Special. Nurses are reaching their COVID-19 breaking point during pandemic. Today, we will continue to lose more American citizens to COVID-19. Yes, hospitals will be full and healthcare workers will be stretched beyond their cognitive, emotional, and physical limits. It is difficult to look at the numbers anymore, they are sobering, more than 2,500 Americans dead in one day from an invisible and pernicious virus. And it is difficult to see nurse colleagues suffering for one more minute of the day. Nurses tell us every day that they need help and are getting sick themselves. They are working while exhausted, begging for mask mandates to protect the public who eventually become their patients, and they are accepting the unacceptable. Why did it have to be this way? The pandemic has opened gaping. Nurses are reaching their COVID-19 breaking point. It didn't have to be this way. Nurses must use their collective experiences and memories through the COVID-19 pandemic to build better systems of care. Nurses work at the nurses' station inside a COVID-19 intensive care unit at Temple University Hospitals in North Philadelphia. Due to the coronavirus pandemic, the hospital converted all of Boyer Pavilion into a treatment space for COVID-19 patients. The pandemic has opened gaping sores within the healthcare system that have failed to be addressed: safe staffing requirements, personal protective resources, consistency in payment models, including hazard pay and equity, ethics, preparedness, respect for the sacrifices of those on the front lines, and the collective grief shared by patients, families, and clinicians. Why do nurses accept this? I have asked myself this question many times. Why do they accept wearing recycled N95 masks multiple times that cause skin irritations and possible infections? Why do they accept occupational inequity in pay when they are loyal employees and choose to remain in the fight at their home institutions? Why do they accept poor staffing when data has told us for years that nurses make a difference in the lives of patients? Why do they accept being told that they cannot be tested for COVID-19 while sports figures can get all the testing they need? When the pandemic is under control, many nurses will want to forget the hazards and inequities that they experienced. And, as a nurse myself, I know that there are many times when we neglect making the efforts required to better our own nursing communities, because fulfilling our professional and ethical oath to care for patients and their families is our highest priority. Also, we look away from the hazards and inequities because we have long assumed that leaders will do what is right, make sound decisions, and protect us. But nurses are afraid and have been afraid since the start of the pandemic. A survey in March to April by the American Nurses Association on COVID-19 concerns reported that more than 50% are worried about having supplies to care safely for patients on their shift, 39% are very concerned or afraid to come to work, and 41% are extremely concerned about accessing reliable and credible information. The surge in cases across the country has only intensified these concerns. Nurses cannot do this anymore. The more nurses look away, the more they accept. They must stand for what is right and just and take ownership of the value of their vital work. Nurses must use their collective experiences and memories through the COVID-19 pandemic to build better systems of care, recognizing their contributions to the public good. Many frontline workers have spoken out about being called heroes when they are expected to be martyrs. People enter some professions knowing that their jobs may claim their lives. Nurses never expect to lose their lives, but to save others' lives. Throughout the pandemic at the front lines of care, nurses' improvisation with masks, staffing, and resources has saved lives. Nurses will always be essential personnel, hopefully bringing their skills and expertise to the bedside and beyond. In her work on the valuation of nursing, Marcella Rutherford speaks of innovative value drivers that mesh caring with the economic and technical aspects of nursing. It will be up to the profession to reframe its position within the economics of the healthcare system following COVID-19. To start, nurses must demand that their local hospital is staffed adequately with the appropriate number of registered nurses (RNs) per patient. Nurses also need to educate the public on what an RN is and why they are essential to any just society. Indeed, the vaccine is coming and promises a way out of this heartbreaking year, but Americans cannot forget what we went through, and nurses and physicians will be forever changed by what they were asked to do, which for many went beyond reasonable expectations and ended in their deaths. When this pandemic is behind us, we must never forget that nurses and other healthcare workers died doing their jobs, and we must never forget that our expectation that they accept such an outcome. Plummeting morale, decreasing staff, and shrinking resources, nurses in desperate need. Hospital management and our legislative leadership must act now to help nurses do their jobs and stay safe amid the coronavirus pandemic. The numbers public health experts use to track the coronavirus pandemic, death counts, percentage positive rates, are rising at an alarming rate. But what my nurse colleagues and I are experiencing at the bedside, inside and outside the COVID units, is free fall. Plummeting morale. Sinking staff levels. Shortages in beds, in people, in equipment, in medication, and, most critically, in active, solution-seeking leadership. Any single one of these deficits is dangerous. Together, they are disastrous. Staffing shortages, in particular, can feed a downward spiral. Nurses who are overworked, assigned to care for too many patients, are more likely to get injured or sick themselves. They then have to leave work, further exacerbating the hospital's existing staffing shortage. In one Pennsylvania hospital, so many ICU nurses are out sick with the virus that management recently mandated that no ICU nurse who is well and able to come in to work can have any time off. This isn't fair to nurses, who, 9 long months in, are intellectually, physically, and emotionally exhausted, or to acutely ill COVID patients, who are desperately in need of attentive care. And given that this isn't our first experience with a deadly and dramatic surge in the pandemic, it points to a severe lack of preparation, a deficit that our nurses are taking on the chin. Hospital management and our legislative leadership must act now. We urge hospitals to bring in more staff. With the virus raging throughout the country, nursing help is an increasingly competitive market. But it is possible to bring in ample agency nurses to replace our members when they went on strike in mid-November. If hospitals are willing to shell out money to fight their nurses and try to break a strike, and, believe me, they need to be willing to spend at least a fraction of the same sum to get desperately needed help for their staff nurses, who are overworked and exhausted beyond measure. We need another CARES Act. We need the help it makes possible. And we need it now. We urge our elected leaders to consider reopening an emergency overflow site such as Temple University's Liacoris Center and other excess demand locations. Our city hospitals are currently at or over capacity, and there is no end in sight. With the new year just around the corner, the numbers are only expected to grow. We also believe Governor Wolf should consider activating the National Guard to assist in this effort and in implementing safe practices in nursing homes, as it did in the spring. We urge hospitals to closely adhere to the Pennsylvania Secretary of Health's recent order limiting elective procedures. This, too, is about staffing. When you reduce elective procedures, you free up staff and add beds to help in the COVID ICUs. Finally, we urge the state legislature to prioritize and pass safe staffing legislation in the coming legislative session and create a presumption of work exposure for any healthcare worker diagnosed with COVID-19. Enforceable safe staffing standards, or limits on the number of patients that can be assigned to a single nurse based on the patient's degrees of illness, literally saves lives, and nurses on the front lines know it. All of the major acute care hospitals in the states are profitable. They give their executives handsome compensation packages. It's time for them to spend money on staffing. We have provided excellent care, endangering ourselves and our families, for 9 long months. It's time for them to step up. Healthcare workers deserve protection and safety on the job, including workers' compensation if we contract COVID at work, and safe staffing standards. We have rules governing how many children a child care provider can care for. Why don't we have a law mandating limits on how many patients a nurse can be assigned, for the safety of both the patients and the nurses? If you like this video, hit like and subscribe. Thanks for watching. See you on my next video.